Okay, this is the third installment in circulation, the last one. Alright, this is about regulation of blood pressure. So, one of the main things, the way blood pressure is regulated in organs, which obviously then affects flow within the organs, is auto-regulation, self-regulation. So let me give you an example. You're doing bicep curls with a weight, but you're only using one, your right arm, and you're really working that bicep brachii muscle. The left arm is hanging at your side. That skeletal muscle is not really doing a whole heck of a lot, and it doesn't need much oxygen, nutrients, or anything else. But the one on the right needs a lot. So you would notice that that bicep muscle and all those cells in the muscle are producing quite a bit of carbon dioxide. They're making probably some lactic acid if you go into, if that muscle goes into an anaerobic type of ATP production, lactic acid fermentation, oxygen debt. And the area will become warmer because heat is a byproduct of muscle metabolism. So, as a result, the blood vessels leading to that organ, to that muscle, and within the muscle, dilate, and you get more blood flow. And that obviously is going to bring in more oxygen. It's going to take away more CO2. It's going to take away more lactic acid. So that's an example of auto-regulation. Other things that can affect it, ions, nitric oxide. We'll talk about nitric oxide and Viagra when we get to reproduction. So basically it allows the capillary beds and arterioles in organs to respond to what's going on locally. Second thing, and the picture you're looking at right here is basically just showing what I've just talked about. Alright, so second, we've got the nervous system and its regulation. This is important. You already know that there's a cardiac center in the medulla. There's also a vasomotor center, and the word vasomotor literally means vessel movement. Vaso-vessel, motor, movement. It's in the medulla. There is a sympathetic portion of it, and there's a parasympathetic portion of it. And you already know the hormones and neurotransmitters involved. Okay. So, when the vasomotor center is turned on, activated, it's going to send messages to the wall muscle of the blood vessels, the small arteries and the arterioles, which you can see in the picture over here. And those blood vessels are going to become constricted. So look at on this big picture down at the bottom left, you see impulses going to that smooth muscle wall, all those fibers, and as a result, contraction occurs, and the whole vessel, because it's circular muscle, becomes much less. The lumen becomes smaller. And that is going to increase blood pressure. You have more friction of blood against the wall. We're talking about peripheral vasoconstriction. It's like stepping on a hose, water hose, that water's going through. Between the spigot in the wall and where you got your foot, there's going to be an increase in blood pressure. When you let off of that hose, the water really comes out at a fast rate. So in that area where you have constriction, within that area, you've got high blood pressure. Opposite, when the brain doesn't send messages, if you look to the right, you'll see far fewer messages, the little red hash marks, pink hash marks, and the muscle of the wall does not contract, and the muscle dilates. Alright, so that's the vasomotor center and what it does. So, when it's stimulated, you get an increase in blood pressure. When it's not stimulated, you get dilation of vessels, and you get a fall in blood pressure. Now, in order for the brain to make the decision about what to do, it's got to get some information from the cardiovascular system about whether you've got high or low blood pressure. So reflexes come into play here. We have two kinds of receptors that are involved in monitoring what's happening. We got the baroreceptors. They monitor stretch of the blood vessels, which obviously more pressure means there's going to be more force of the blood against the wall, and it's going to be prone to kind of stretch out a little bit, like blowing up a balloon. When the pressure is low, there's not going to be very much stretch. The vessel is going to stay whatever size it is, and the receptors become quiet. They become important and stimulated when there's an increase in stretch and due to pressure. Okay, chemoreceptors, they're monitoring chemicals, and they monitor carbon dioxide, oxygen, both in blood, as well as the pH of blood. We'll talk more about these coming up. Okay, now, let me show you the locations here of these guys. So, here is the aorta right there, and you've got a brachiocephalic branch of the artery right there, and it then splits off into the carotid going to the brain up here at the end there, and then this branch right here is going to the arm. Don't really care about that right there. Alright, then second branch over here is the carotid going to the brain, but this is, whereas the one over here was going to the brain, it's going to the right side, this is going to the left side. And then the third branch of the aorta is the one going to the arm over here. Alright, so let me erase all that so you can see this. Okay, so notice these little dark node-like things inside of different areas. You got a few of them in the aortic arch, and you've got one in each of the carotids. The ones in the carotids are called carotid bodies, and the ones in the aorta are called aortic bodies. And they're the main ones that are monitoring pressure, and you can see how important those carotids would be, because if pressure drops in those vessels going to the brain, brain's not going to get flow, or adequate flow. Okay, so we're going to talk about examples here in just a second, but before I leave, let me point out this arrow, which has to do with temperature and ions. We'll talk much more about ions later. Sodium, potassium, calcium, things like that can vary the effect on the vasomotor center and what it does. Temperature does also. Remember, temperature increases metabolism, and so you're going to get an increase in heart rate and cardiac output and blood pressure. So that's going to turn the vasomotor center on, except it's going to cause vasodilation in order to compensate for the increase in blood pressure. Okay. So let me take you through a scenario. This is one. Alright, so let me go back to the marker here. Alright, so for whatever reason, we have a drop in blood pressure. I don't know. Maybe you're in a coma. I have no idea. You're bleeding to death. Whatever. Alright, so remember, the baroreceptors get turned on with an increase in blood pressure. In this case, there's less. Now, this signals the brain. I mean, either way it signals the brain. If they get turned on, that signals the brain directly. If they turn off, then the brain goes, whoa, wait a minute, there's no information coming in. And it's going to do the opposite than if your blood pressure went up. Alright, so we have less baroreceptor activity. And notice both the cardioacceleratory center in the cardiac center of the medulla and the vasomotor center become turned on. And let's go with vasomotor first. So here's vasomotor center stimulated. This is going to now activate smooth muscle in the walls of the small blood vessels. That causes vasoconstriction. That increases resistance. Remember, resistance is a key factor. When resistance goes up, that's going to increase blood pressure. All right, let's go the other way. Cardioacceleratory center is stimulated. You get sympathetic activation, epinephrine, blah, blah, blah. You get both increased SA node activity, which is going to increase heart rate, and you get stroke volume going up. Heart becomes stronger in its contractions. And remember, HR times stroke volume, SV, increased cardiac output. You increase cardiac output, you get an increase in blood pressure. Okay. If we did an increase in blood pressure, everything would just reverse. It's not shouldn't be difficult to understand. Okay. Another important thing here. Well, let me just take you through what happens if blood pressure goes up. This is in your notes too. You get an increased stretch of the blood vessels. Let me go back to this picture so you can kind of see the reverse. So anyway, because of high pressure, it's going to kind of push against the small blood vessels. They get kind of stretched out a bit. Not dilated. I'm not talking about that. I'm just talking about increased pressure at kind of pushing against those walls. The baroreceptors fire. That then turns on the vasomotor center and the cardiac center, just as it does in this first example. Except now the parasympathetic nervous system is going to become the dominant one, and you can see we're going to reduce SA node firing, and stroke volume is going to go down, and that's going to mean less CO, cardiac output, which decreases blood pressure. And the vasomotor center is going to stop sending signals to the muscle of the vessels to contract, and they then dilate, and that drops blood pressure. There's less resistance. Okay, so let's go over to hormones and kidney. All right, we're going to be talking a lot about hormones here, but let's go with two from the kidney. Let me start with EPO. We've already done it. Bone marrow makes more red cells. Blood becomes thicker. Remember that blood cells, particularly red blood cells, are something like around 45% of your total volume of blood. So, increased thickness of blood, increased resistance because the blood is thicker, harder, you got more friction against the walls, and that's going to increase blood pressure. Okay, so let's turn to renin. All right, the kidney makes a hormone called renin. Normally, renin is only made under circumstances where there's less flow to the kidney. It's a negative feedback mechanism that helps restore the blood flow to the kidney. The way renin does it is it activates an enzyme, a hormone, called angiotensinogen. It's inactive. The word inogen, or the suffix, means inactive. It's made in the liver. And renin converts angiotensinogen in active form to the active form, angiotensin 1. Now, angiotensin 1 doesn't do a heck of a lot, but if angiotensin 1 is converted to angiotensin 2, you've got the body's biggest vasoconstricting chemical, angiotensin 2. Peripheral vasoconstriction, huge increase in blood pressure. Now, I said if angiotensin 1 is converted to 2, so what does that? Well, we're going to talk about this in the respiratory system, but there is an enzyme that does this, comes from the lungs, goes into the blood. It converts angiotensin 1 to 2. It's called angiotensin converting enzyme, or usually you see it as ACE written out, large letters. Okay, there's another thing that angiotensin 2 does, in addition to vasoconstriction and increased blood pressure. It kicks in a couple of the other organs to make some of their hormones. So if you look at this picture right here, all right, right here is the main thing I've just gone over. But let me point out, let's see, here's vasoconstriction right there. All right, so look at the adrenal gland, the adrenal cortex, making aldosterone. Remember, sodium retention and water retention. Boom. Second, from the posterior pituitary, ADH. Remember, this is for water retention. And again, that's going to increase blood pressure. So you've got kind of a dual increased blood pressure. Okay. This is a picture out of your book showing how some of these hormones work. Let me point out, well, let's keep going with hormones here for a minute. Most of these hormones increase blood pressure. Adrenaline, epinephrine, you already know, fight or flight response, increase blood pressure. Renin, I just talked about. It's called the renin-angiotensin pathway. Wait a minute, I gotta get back. All right. Aldosterone, just talked about. ADH, just talked about. By the way, the other name for ADH is vasopressin, which literally tells you it increases blood pressure, pressure in the vessels. EPO, I just talked about. Now, atrial natriuretic hormone comes from the heart, which is why atrial is in the name. Natriuretic, okay, you probably know what a diuretic is. It's given to people. Well, and there are some natural ones, but usually they're given as pill form. And it causes water loss from the body and electrolytes to be lost. And they're given to drop blood pressure. So diuretic drops blood pressure. Natriuretic means gets rid of sodium. Na, sodium, uretic, as in diuretic. This is a hormone that causes, it counteracts aldosterone. Aldosterone causes you to retain sodium. Atrial natriuretic hormone causes you to dump sodium. When you dump sodium in urine, water's going to go. So you lose water, right? You lose water, your blood pressure drops. So this is the only one of all of them that drop blood pressure. Okay, I mentioned pH, CO2, and oxygen. So again, I'm going to give you some examples of these flow charts in lecture. We're going to talk about these more. But it works very much like that flow chart, circular flow chart that I showed you on increase and decrease in blood pressure. Same components, a little bit different end result. So again, here's kind of everything summed up. Talked about the kidneys, talked about cardiovascular system, vasodilation, cardiac volume. Okay, moving along. Oops. All right, odd and end things. Alcohol, I've already mentioned temperature. Alcohol is a depressant, by the way. It decreases blood pressure. So let's talk about temporary blood pressure changes. So you're lying down, and when you're lying down, all your blood vessels are on the same plane, right? Horizontal, whereas when you're standing up, sitting up, you got gravity playing a part because it's particularly pulling down on those legs. But when you're lying flat, everything is on the same plane. Now, what happens then is you get more blood down into your legs. And because your blood kind of spreads out a little bit better then, you get a drop in blood pressure. Now this is fine when you're lying down. The receptors, baroreceptors, are turned off. By the way, these receptors, I didn't mention at the time, but that information from the receptors when they're activated goes via cranial nerve 9 and 10. Remember, 10 is vagus, glossopharyngeal is 9. Those are the cranial nerves that carry that info. Anyway, the baroreceptors are turned off. The parasympathetic nervous system is inhibited. Sympathetic turns on. And you get an increased heart rate, and vasoconstriction occurs when you get upright. So in other words, you're lying down, your blood pressure is low, everything is cool. But when you get up too quickly, if remember, your brain is supposed to get that blood pressure up pronto, so that by the time you're sitting upright or standing, your pressure is high enough to get that blood to the brain. Remember, your pressure was low when you were lying down. So sometimes when you get up too quickly, that pressure is not compensated quick enough. It doesn't get up high enough that quick, and you don't get enough blood flow, and you become faint or dizzy. Now, this is not a problem for most people. But if you are 85 and you have cardiovascular problems anyway, this can be a real problem. It's called orthostatic hypotension. Remember that when you go upright, sitting or standing, Your brain is supposed to compensate for the low pressure and get it up quickly so that your circulation can get to the brain. If the blood pressure stays low because of semi-functional baroreceptors, the brain doesn't identify that low blood pressure and doesn't do anything about it, and you get up and your pressure is still low and you don't get enough blood to the brain and you're out. Okay, the second one is Valsalva's maneuver. You've done it before. Probably the most obvious time is when you're trying to defecate. So you're sitting on a toilet and you're straining and it's just not working for you. And you take a deep breath and you just really increase the pressure in your thoracic cavity. I mean, you take it and your diaphragm is going to go down and you're straining. All right. And what that does is it increases pressure in the cavity and it pushes against the veins, which makes it harder for that blood to come back up to the heart. You get a drop in blood pressure. Now, the receptors aren't stimulated. The brain knows what's going on. It's compensating. It's going to compensate for blood pressure to get it high again. Now, after you've defecated, that pressure has to go down again back to normal. So again, what's going on is you get an increase in pressure just transiently while you're, going to the bathroom. But in some people, the blood pressure may not return to the low pressure. It stays high. So this is the way Elvis Presley died. It was due to Valsalva's maneuver. His blood pressure did not go down, and he suffered from a situation where the blood pressure just went too high. He died in the bathroom, by the way, in case you didn't get that.